Okay, let's talk about something fascinating. A lifelong companion that, well, most of us have, but probably don't really understand. It's a master of disguise, an expert at hiding, and it has this incredible story of infection and reappearance. Today, we're pulling back the curtain on the herpes simplex virus, or HSV.
To get a sense of just how common this is, just look at this number, 68%. Studies show that a staggering 68% of the U.S. population has antibodies for herpes simplex virus type 1. Think about that for a second. That's more than 2 out of every 3 people. It's one of the most successful organisms to ever make its home in humanity.
So what is it exactly? Well, at its core, HSV causes these little blisters on the skin. But here's the crucial part, the thing that makes it so interesting. It happens in 2 completely different ways. First, you've got the primary infection. That's your body's initial encounter with the virus. And then there's the secondary infection. That's what happens when the virus, which is already hiding inside you, decides to wake up and make a comeback. So here's how we're going to break this all down. We'll start by looking at the 2 faces of the virus. Then we'll walk through what that very first infection is like. After that, we'll get into the virus's incredible ability to go into hiding. From there, we'll check out what triggers it to come back, and finally, we'll cover how it's actually diagnosed and managed. All right, first up, let's get this crystal clear. The 2 fundamental states of a herpes simplex infection. Honestly, understanding this difference is the key to understanding the entire life cycle of this virus. So, you've got the primary infection. This is the virus's big debut, the very first time a person is exposed. And what's wild is that a lot of the time, it's totally asymptomatic. You might not even know it happened. The secondary infection, though, that isn't a new infection at all. Nope, it's the original virus reactivating from its dormant state. This is what we all know as cold sores or fever blisters. And the virus itself comes in 2 main flavors, HSV-1 and HSV-2. Now, generally speaking, HSV-1 is the one that causes sores around the mouth and face, while HSV-2 usually affects the genital region. But here's the thing, either type can infect either location. And here's a really crucial point for anyone in healthcare. Just by looking at the sores, you absolutely cannot tell them apart. Visually, they're identical. Okay, so let's zoom in on that initial primary infection. When it actually does cause symptoms in the mouth, it gets a very specific clinical name, primary herpetic gingivostomatitis. A bit of a mouthful, I know. So what does a symptomatic first infection look like? Well, you'll most commonly see it in little kids. It starts with these tiny blisters that break open and become multiple, really painful ulcers. A huge diagnostic clue is that these ulcers can pop up pretty much anywhere inside the mouth. And this isn't just a local thing. The kid will often feel awful, fever, tired, just generally unwell. The good news, it's self-limited. The body fights it off, and everything heals up in a week or 2, no scars left behind. But here's maybe the single most important fact about primary HSV. That dramatic picture we just painted, that's the exception, not the rule. For the vast, vast majority of people, their first encounter with the virus is completely silent. No sores, no fever, not a thing. The virus gets in, sets up shop for life, and the person has no idea it even happened. And this brings us to the most brilliant and, let's be honest, kind of sinister part of HSV's whole strategy, its ability to go into hiding. This is the science of pathogenesis and what we call viral latency. Let's actually follow the virus's journey, step by step. It starts with contact, right on the skin or mouth, and it starts replicating. But it doesn't just hang out there. Some of the virus particles actually travel up the trigeminal nerve. That's the major sensory nerve for your face. Their destination? The trigeminal ganglion, which is basically a bundle of nerve cells. Once it gets there, it enters a state of latency. It effectively goes to sleep and just waits. So how on earth does it stay hidden from our super sophisticated immune system? Well, the virus is a master of camouflage. It actively messes with a system called MHC class I. Okay, think of MHC as a little display case on the surface of our cells. Normally, this case shows our immune system what's going on inside. But HSV basically smashes this display case, so the infected cell can't signal for help. The immune system's patrols just cruise right on by, totally unaware there's an enemy hiding inside. It's genius, really. So now we've got to shift gears. The virus has successfully infected the host, and it's established its secret hideout. But it doesn't stay hidden forever. Now we're going to look at the secondary infection, that recurrent outbreak, which is all caused by the reactivation of this latent, sleeping virus. You know, for many people who get recurrent outbreaks, the virus is nice enough to send a warning signal.
These are called prodromal symptoms. Hours before any blisters even show up, they might feel a really characteristic tingling or an itching or a burning sensation in the exact spot where the sore is about to form. That feeling, that's the reactivated virus literally traveling back down the nerve from its hideout to the skin.
So what wakes the sleeping giant? Well, a whole bunch of different stressors can trigger a reactivation. Strong sunlight exposure, that's where the term fever blisters comes from. Getting sick with a cold, that's where we get cold sores. But also physical trauma, hormonal shifts, emotional stress, or really anything that weakens the immune system can all send the signal for the virus to wake up and cause trouble.
So let's just quickly put the key differences side by side. Primary infections, usually in kids, can be anywhere in the mouth and often come with a fever. Secondary infections, more common in adults. They're localized to specific spots, like the lips, and you almost never feel sick all over. And of course, the cause is totally different. One is a brand new infection. The other is an old one, waking up.
So given this really complex life cycle, how do we actually manage it? Let's talk about diagnosis and treatment, but always with the understanding that we're managing a lifelong condition, not curing it.
When it comes to treatment, there is one golden rule. Timing is everything. For antiviral meds to really work, they have to be started early. We're talking ideally within the first 48 to 72 hours. This means you have to act on those first warning signs, that tingle or burn. If you wait until the blisters are fully out, the medication just becomes way less effective. Now, there are two main ways to go with medication. You've got systemic antivirals, like acyclovir pills, that work throughout your whole body. These are much more effective at controlling the virus and can seriously shorten an outbreak. Then you have topical agents, creams and ointments, and honestly, their benefits are pretty limited in comparison, even if you apply them early. And this brings us to the most crucial point about management. The goal of every treatment we currently have is to control the symptoms of an outbreak, to make it less severe, less painful, and help it go away faster. What these drugs don't do is get rid of the latent virus hiding in your nerves. The infection is still there for life, so the whole goal is just to manage their occurrences.
Okay, so let's wrap this up with the most critical takeaways. First, herpes simplex is like a two-act play. You have the primary infection, which is often silent, and then the secondary recurrences we all know as cold sores. Second, the virus's real superpower is its ability to go dormant in our nerve cells, that state we call latency. Third, remember those recurrent outbreaks are the same virus waking up. It's not you getting infected all over again. And finally, while we have great treatments to manage symptoms, we don't yet have a cure that can get rid of the hidden virus.
When you really stop and think about it, the way HSV has co-evolved with us to hide in plain sight right inside our own nervous system, it's a true masterpiece of biology. It really makes you wonder, doesn't it? As we learn more about viruses like this one, what other biological secrets, what other incredible complex relationships are just hiding right inside of us, waiting for